So I just started my Dermafrac micro dermabrasion, and you can kind of follow along. This is a crystal impregnated pad along with the suction to perform a microdermabrasion. And I'll get under my eyes when I can take my glasses off, but I'll just let you see how easy it is to use. And you don't have to do a microdermabrasion when you're doing a dermafrac, but if you want that extra added layer of exfoliation, it's really a great thing to do. But in the summertime, it's nice not to do it. I won't be in the sun today, but I can at least, let me get my chin over here. If you want to spare some of the epidermis so that your clients can enjoy a little bit more time in the sun, not direct sun, but you can skip the microdermabrasion. Many of my clients just have the microdermabrasion, and you can go both ways just like you do on any other microdermabrasion, or you can even do a 3-pass type of microdermabrasion. I'm just kind of going around here because I got to keep my glasses on. Hey, Kelly, how are you doing? Thanks for watching. So I'm going to do this side of the chin. Hey, Joe Goff, you got on. That's great. Awesome. And Joe travels a lot, so you would just love this machine because it's small. It's very heavy, but it is small and mighty, made here in America. And what I like about it is I can really get through a procedure. And we're going to do the microderm and the microneedling today. So let me just see if I can see you guys. So we're going to do both, and you're going to be like amazed at the time it takes to do it. Microdermabrasion, as we all know, isn't something that is a lengthy procedure. It's an easy procedure to do. The clients all love microdermabrasion. They know what it is. And then when you hit them with the Dermafrac microneedling, that's the best. So I'm going to do the rest of my lower face here. And I'm going to Dermafrac my lips, under my eyes, even my earlobes today. And that's something I think is really easy to do with Dermafrac. I've used all the different types of microneedling out there, and this is so much easier to get into those tough spots, even the nose, under the eye, everywhere else. And one thing that I think people neglect is doing the hands. After my treatment, while my client is under the red LED, I'm going to turn this down and I'm going to do under my eye. So I can't really see who's on right now, but I do like to get a little bit under here. I turned it way down just to get a little exfoliation, help it out a little bit more. And I'll do the eye here. Now, if you're doing just a standalone microdermabrasion, you may drag it out a little, but there's no need. Microdermabrasion is so easy to do and doesn't take but a few minutes to make a full pass along the face, like a 2-pass. And again, I did turn the suction down here because the skin is a bit more delicate. Now I'm going to ramp it up a little. Okay. And I'm going to do right between here. We all love this. It's hard to do this on film because everything's turned around. So I think I know where I'm working, but I'm not. So I'm just going to do this. So I don't know about you, but I'm always about time. I love to make sure that my clients, where am I? I'm not wasting their time. And for me, time is money. If I can get my clients in and out of the office quicker, then guess what? They have more time to themselves, and they appreciate that too. You don't have to be super quick or act like you're working quick, but they really do like it when, let me see, where am I? When you take care of their time. And if you're doing packages of microdermabrasion or packages of microneedling, we want to be respectful. We don't want them in the office too long. So with the Dermafrac, my clients aren't in the office more than 40 minutes ever. Sometimes they're in 30 minutes. If I don't do a pre-treatment like this, they may just be in for 30 minutes. And that's including the Illuminate LED. That thing is so powerful. It only takes 5 minutes to do. So you want to definitely get your hands on one of those if you want to save your clients some time. Also, the Dermafrac. I've never had a microneedling system that worked like that. I'm also going to take a little microderm on the ear here. Don't forget to do that for your clients because the ears tend to age us. So if we take good care of those lobes, the client will like it. And they also get a little wrinklage. So you want to get in there and definitely do that. Okay, so I'm going to do this as well. Finish up with this. Now these heads come in this shape, or there are longer shapes, like if you want to do the back or you have other areas. This one is real nice. It's about the same size as any normal microdermabrasion head. Feels so good. And we all know how that feels, right? Microdermabrasion is fabulous. No matter what device you're using, microdermabrasion is so therapeutic for the skin. Many of my clients think of it as going to the dentist and getting their teeth cleaned. And so when I do a microderm on the neck, I just take it the one way. I don't hash it. I just make sure that I get a second pass in there because they really, really like this. And you can see how nice and pink the skin gets. So you're getting a good microdermabrasion. Okay, so I'm done with the microdermabrasion portion, and it's only been about 7 minutes. So I'm going to turn it off for a second. I'm going to change out my handpiece. If you were live with me right before I actually did go live, I already set up my Dermafrac. I have my Rejuvenate in here and my 0.5 microneedle. I'm just going to take the cap off the back here. Sometimes when I'm on film, I leave it on. But anyway, I am going to start. Now I have it set at 3. I'm going to bump it up a little for me because I like it a little hard. So I'm going to start here. And with Dermafrac, it's important that when you're using it, for those users out there, is to pull it. You don't want to push it. You want to let the suction pull the skin. That feels so good. And then let the needles go directly into the skin. Ooh, that's nice. Now, if you noticed, I didn't use any numbing cream, and I'm at a 0.5. And 0.5 on other devices, I would have used some numbing cream, especially maybe the forehead and the lip. But here I don't. And what makes it really good is that the suction will pull the skin away from the bone. And here in the cheek, it's nice and fleshy. It generally is not uncomfortable, but I think I'm going to up it even a little bit more. Okay, there we go. When I'm on film, I get so confused because everything's opposite. But I go back all the way to the ear. So I am going to make 2 passes, vertical and horizontal. I'll leave the tissue around the eye for near the end or when I turn it down. Here I want to get in here really good too. And maybe then I'll turn it this way. Sometimes I can't make those big sweeping motions that I do like to make because of the skin, the contours of the face. So I'll just make sure that I'm getting down here real good. Okay. So I'm going to turn it down. And if you're watching, I usually do this at the very end, but sometimes some of you guys I know have to pop out of here. So I love this. This is, I call them angel kisses. And you can get right up to this, all the way to the lashes. and you're getting those micro needles in there at 0.5. And the serum, I can feel that serum going into the skin, which is a great thing, because when the serum gets into the skin like that, I don't need to use a mask, a sheet mask at the end. My skin is going to be very well hydrated. I'm going to turn it back up so I can get to the other side here. Again, I'm going to pull the device. I'm not going to push the roller. So I've used rollers in the past, and I've loved rollers. You know, I think rolling is a great way to microneedle. But this has that extra added bonus of the suction, which is pulling up the skin so the needles go in at 0.5. There's no you can't do it any lighter or heavier. It's going to get in at that 0.5. And with every turn of the wheel, the serum is bathing each needle, getting into the skin, hydrating it, and getting whatever the serum is that you're using. One of my favorite serums is the lightening serum, because, you know, we deal with so much hyperpigmentation, whether it be around the face, the neck, the décolleté, but, you know, we have to think about those hands. And this is such a quick treatment. You can do the hands while your clients are under their LED. So don't forget to do that. Now I'm going to do my vertical. It feels so good. It is tingly, though. I won't lie to you. It does, you know, it does tingle, but it's not enough for me to want to have a numbing time for my client. And it's not because I'm mean, because I'm very nice to my clients, but it's something that we just don't really need to do with this machine. It hurts a little bit, but that's fine. It's supposed to. Now I'll do my chin. And again, I'm going to go 2 different ways, 2 different passes, and I can just feel that serum getting into the skin. You know, I used to microneedle and use like the little roller devices that would put the serum on the skin, and then we would stamp it into the skin. But this, I know, is really getting into the skin with every turn that I'm making here. And it's safe enough to do around the eye, like you saw, but also the lips. So at the very end, I love to make sure that I do my client's lip. It helps plump it up. They love it, and you will too. So let me see. Can't really see without my glasses. Do you end up with any waste of the Rejuvenate, or do you try to do additional areas? Oh, well, I use it all up. So what I do sometimes is, if somebody has a deeper line or wrinkle, like even the crow's feet, I'll take it and really get in that area, stretch the skin really well, so that those needles are getting right into where the belly of the wrinkle. But I generally don't have any left over, because I either do 2 full passes, face, neck, and I can get the décolleté in there. So sometimes I won't have enough for the hands. But if I do just the face and the neck, then I can definitely get the hands in there too. Yes, Natalie, you can put a serum of choice in it. So they're called custom cartridges, and you can put your own serum in. It still comes with a new head for everyone, but it just has to be more of a fluid. It can't be a very thick type of serum. Yeah, and if you guys have any questions, feel free. Contraindications for doing Dermafrac would be like any other microneedling procedure. And this is always a problem area for me. Okay, so now I'm going to get to the forehead. I'm going to turn it down just a little, because the forehead is a little spicy here. As you can guess, usually it is for any microneedling device, but maybe my first pass, I'll just do it on a 4, and maybe then I'll ramp it up to 5. But you can see How nice that's going in, right? Yeah, I'll take these off for a minute. You don't have to overstretch the skin when you're doing a dermafrac, but if somebody's got loose skin, yes, you're going to have to, or you're not going to be able to get those needles in at the correct depth that you wanted. I didn't do this side here. So let me just do this. Or did I? Anyway. This backwards camera is getting me, so I hope I don't miss anything. And you can move slower than maybe I'm not really going too fast, but I don't rush through my procedure there. I do like to take my time. I didn't do this side. Oh, I did. This is the side I didn't do. Well, I'm going to do them both again because I can't remember now. When you're in your own space, you know, you really, maybe I can get real close and you can see how this is working. I don't have any makeup on my eyelid, and I can go right on top of the eyelid. And it's putting that nice serum in there. Now I'm going to do this side again. I'm going to make another pass on my forehead because I'm not sure if I did it all when I was talking. And if you have any questions, let me know. So I'm using the Rejuvenate serum. There's a lightening serum. There's a clarify serum for those that are acne prone. You wouldn't do it on active acne, as we all know, but there is a clarify. I really love the lighten. I like the hydrate when, say, especially in the summertime like now. Oh, I'm going to do the nose. In the summer like this, it's great to hydrate your client's skin. Or if they have a red carpet event, and here, because the nose is a little tight, you can use the kisses. And the kisses get right in there, get right into those bunny wrinkles there. So this will help shrink those pores, at least clean them out. The microdermabrasion helped, but this is also helping. And it is something I do. Yeah, I got that question. How often would you do a Dermafrac? Just like any other microneedling procedure. When I package mine out, I do them in packages, usually 3 weeks. I like to get my clients their results quickly. And, you know, they don't want to drag it out for 6 months. They want to get the results a lot quicker. I want to show you, you have to do the ears for your clients. They'll love it. And it is very rejuvenating. And we need to have those ears looking great. Hey, Mercy, how are you, my world traveler there? Do you microderm your ladies' earlobes, Mercy? I bet you do. With devices, though, sometimes it's a little hard to do, but this is so easy. I can just roll this on, which I love. Now I'm going to do the neck, and what I'll do is I want to pull this, right? I don't want to push it. So I'm going to start back here. And when you can see what you're doing, sometimes things roll a little bit better. Oh, that feels good. Now I have it at a higher suction right now. The neck is always something your ladies and gentlemen are looking for ways to rejuvenate their skin. Oh, that feels good. And I sent out my last email on the Dermafrac, and I had like 4 Skin Classic providers that already use the Dermafrac. So I thought that was pretty cool, and they love it. Their clients love it. And a couple of them are trainers of mine, like Peggy Corsello, Karen Bevilacqua. And if you're watching, let me know where you're watching from. And if you have a Dermafrac, let me know, and let me know how much you love it. And if anybody's here at the Dallas show today or tomorrow, go visit the Dermafrac people. And I'll show you the waste station where the serum goes into the waste container, so you can see that there won't be much in the way of serum in the waste container because it's in the skin. So my skin feels hydrated, although any microneedling will from time to time make the client's skin feel dry, right? So I want to maybe go over a couple areas. Let's see, we're only down to 20 minutes. Let me see, is that right? Okay, 2105. So I have more serum in here. So I'm going to go over my more problem areas, and I would do this for my client as well. You can make up to 4 passes with your Dermafrac. So my lower face here really needs to have a little more attention. And I'm up as high as I can get. It's a little pinchy, but I like it. So I am going to try to use up the serum as much as I can. I just have a little bit left. No, I have more than a little. Now for the lip. Right on the lip. So long as the client isn't a fever blister sufferer, then you just want to stay away from that vermilion border. But, ooh, you can do the lip. Let me see. I got a few questions here. Does it come with a manual? We will have suggested settings for areas. Oh, yes, of course. And also, I would be the one to do your training. So even though I know we all know about microneedling, we all know about the microdermabrasion, but once you get a device like this, I really want to make sure that you use it properly so that you can get the most out of it and benefit your client. How expensive does it take to do a service on a client? Very good question, Kim. So the syringe and the headpiece is either $38 for a 0.25 or $42 for the 0.50. And the 0.50 is what I use 90% of the time. So now I'm really kind of done with my procedure, but I'm just going to go ahead and get a few more areas here paid attention to. And so I know that might sound like a lot, $42, but I used a stamping device and I loved it. I thought it was great. But between the headpiece that was like $20, $25, then the serum that you rolled on, which was a very small amount, but we rolled it onto the face. That was another 20 plus, say, a sheet mask. So all of those things combined were a little pricier. So this is less pricey. It's very sanitary. You're just going to throw it away. And I don't use a sheet mask when I'm done. I just put my client under my Illuminate LED for 5 minutes. So that's what I would be doing right now at this moment, is getting under my red LED. But we have a little more time for any questions that you might want to ask. So yes, thanks, Joe. I love my Dermafrac. I'm obsessed with it. And I make sure that I do it every 3 weeks for myself. I'm going to do my ears again so you can kind of check that out. Hey, Cindy Motsinger, how are you? Yeah. See all my Skin Classic providers popping in. That's great. So with regard to the Skin Classic, like any microneedling procedure, once all the junk is gone, it's so great to go ahead and start using the Dermafrac. Their skin will look amazing, and it probably looked real amazing from you guys getting rid of all the skin tags, the brown spots, the broken capillaries. So go ahead and put the icing on the cake. Oh, what do I charge? Okay, so just the Dermafrac alone, I charge 150. But if I'm doing either the microdermabrasion or a dermaplaning, I charge 195. I do bundle a treatment protocol for them where they also go home with my Definage skincare. So they'll use that, and they'll do the 6 treatments. So, or 3 treatments, whichever one that they want. So with many of the microneedling procedures out there, you're charging 200. So this is very comparable, but it's so quick. So I'm done, right? So this is a quick treatment. So even though it's microneedling and all of that, I'm not going to overcharge my client. Now, if you're in a different market and you've been charging a lot for your microneedling, go ahead. Keep the same charge. But for me, I can offer this to most of my clients. Now, I have put most of my clients that were microdermabrasion or dermaplaning and microderm, they're all doing this now. This is a better treatment for the skin, meaning it gives the skin a bigger boost. And if I can make it affordable, they do it more often. So about 80% of my clients are turned on to this. I did an introductory special for them. They loved it. This way, they knew what they were getting into, and the packages are what will really help you and your client get those results, get those before and after photos, things like that. But you can see from my page what great work this is. So I'm really done. I can't really do anymore. I might do my hands. Let's see here. Let me turn this off for a second and I'll show you without spilling. So we went from a whole syringe to just this. That's great. And so most of that serum is sitting in my skin. So if you guys have any questions, let me know. Now, also, if you think you want to invest in a Dermafrac, private message me below. Tell me I'm interested, and I'll send you our latest offer from Dermafrac. And let's see. Yeah, and Joe, who travels a lot, right? Look at the size of this machine. It is perfect. It's small, but I'm telling you, it's really very heavy. It's heavy because it's got a very powerful motor in there. Very powerful. And it's made in America. There's a 5-year warranty, and these people are really nice to work with. Genesis Biosystems. I got my very first microdermabrasion in the year 2000 from them. And so I've been with this company for many, many years and highly recommend their equipment and customer service. So, but I would love to take care of all of your needs. So if this is something that you would like, just make sure you message me. Oh, how often do you clean the tubes and the waste container? Well, after every client, I do empty out the waste container. And I also take a little alcohol through the tubing just to clean out the tubing. And of course, wiping it all down with like Sidex or Barbicide wipes. So, but yes, I do empty that little container just right into like a Dixie cup, and then give it a good wipe off with the other and put it back in. And I do take, I don't know if you guys do this as a little trick, but if you take a little piece of, say, your Barbicide wipe, that type of thing, take a little piece off and roll it tight. and then put it through the hand piece and put the suction on, that will go and clear out your tube very nicely. So I'll do that one. I'll do it next on a video when I have it there to show you. But it's very easy to clean the inside of that tube. And okay, well, great. Well, I hope that everyone has a fabulous day and go out there and kill it with your Dermafrac. And I will too. I'll see you all later. Just hit me up if you are interested in the Dermafrac and I can get you more information, actual video on doing it on a client and all of that good stuff. And I do the one-on-one training with you personally online and a live model. So I'll look forward to working with you. I hope you liked this. Now I'm going to hop under my red LED. So I will see you all later. Bye-bye.